along. There are times during the presentation I will stop and Brooke will let me know if there's any questions in the chat um, that we should handle while we're there. So feel free to ask those questions. And hopefully we do some goal planning around at the end how we are going to deal with this. Essentially, we're going through the benefit cliff, right? Just like our clients do. We've had these extra resources. So how are we planning and working to keep sure that we're ready for that shift? So I wanted to cover the status of the other funds that we have that could be utilized for homeless programs through the Homeless Crisis Response Program. We have the Emergency Rental Assistance Program, and we'll have somebody from OCA here to talk about that. That's in the slide getting ready to come up. So those resources are out there for rental assistance. We're going to talk about how we have some ESG-CV funds. In the next slide, we're going to look at how much there is and what the rules are that apply to those. We'll also talk about the additional resources that we had in the Emergency Solutions Grant Program. And we've been working on taking a look at these Ohio Housing Trust Fund dollars are going to be able to assist and plug this gap. I had invited Ben to come talk about CDBG-CV as the potential funding source, but those funds are sort of wrapping up at this moment. So I know that we have some folks from homeless programs going through CDBG-CV, but not a lot of that is going to be able to come back online. I'm pretty sure Ben's at a place where we won't be able to distribute those out anymore. And we do have funding coming for the Home American Rescue Plan funding. So we have about 10 million in resources that can be put towards creating a non-congregate shelter. And in the home ARP notice, they define that as being a shelter where if I'm presenting as a family unit, that my family and I are not split up and we're not sharing a room with other people. To be non-congregate, each person in that household unit must have like not their own bathrooms each, but one bathroom per that household that they have 24-hour access to. And then they will also have to be able to get into their room 24 hours a day and be able to stay. They are allowed to have a shared kitchen. So this is really a good opportunity for us to revitalize some of our older shelters or create new shelters that will show the evidence is showing that it's less traumatic for families to be in non-congregate shelter, and HUD is seeing that the outcomes of those program participants are better. So in this slide, we've documented, what we have left there. So there's around 7-8 million that's not been spent in the ESG-CV, but most of it is out in Grantee's hands. We do have, a small portion of funding that we have been pulling out from. So some of the amendments that have been entered, we are starting to move those again because we had a couple of grantees return their ESG-CV and we were able to redistribute it out. We also ended up doing that with the Emergency Solutions Grant. And with that program, we we were limited in that we had to give the money to another grantee who also had the same type of grant. And we did get that 941,000 put back in and brought some ESG-CV back in and are pushing that out right now. So you guys can see the numbers down there about what we have. There are additional Ohio Housing Trust Fund dollars. So some of these -3 grants are the TRRH funds that we've been extending for several years. We're going to stop doing those for right now until we get through this duplication of benefit and recapture process. How it stands right now is Ocean is only going to allow us to give back the state funds to folks that already have the state funds. And then those grants that we're closing for the TRH will be getting their final reports in here soon. And that's something that we could also bring online, but would need controlling board approval to be able to do that. Okay, I'm sorry, apologize. I'm getting some chats. I think Letitia is trying to get into the meeting. Let me. Claire, is there I'm getting some chats. The next presenter is having troubles getting into, or the next person who's talking is having troubles to get into. Is there a phone number I can give her instead? Yeah, is there a call-in number?
Yes, there is. Is it our Letitia? Because I can send it on to her.
Yes, please. All right, well, we'll go ahead and jump ahead a little bit, and then we're going to go back. So a duplication of benefit, I've defined it right here. Essentially, a duplication of benefit is that you cannot get funding, right, for the same issue twice. So a lot of this is not only on the individual program participant level, and I'm really less concerned about that because most of us have some questions that we're putting into our client files that already does that, right? We're always checking to keep sure that, for example, the housing authority has not, spent $500 for the month of June, and then they come to community action and they also get $500 for that. We do have those as a system put into place. But I've linked in this document the HUD information materials that there are, and also a link to the materials that we have around it. So essentially, we were to be assessing all of the other resources that the grantees have to put towards rental assistance or supportive services for homeless or at-risk families. So the reason why we're running through this again is because when we pushed out these grants in our leverage funds, we needed to also be considering them for other funding sources that are covering the same thing. So I'm not concerned that you can't really spend the money on something twice. So what if there was a duplication of benefit, it would be related to perhaps, using funding from both pots on the same thing. So I don't feel that any of us duplicated benefits, but we need to take the steps to keep sure that we showed that HUD that we have not. So duplication of benefit happens at both the activity level and your program participant level. We just covered that. But we are doing it for all of the activities. And I don't know if we have any of the HOPWA folks on today, but your activities are also listed in the documents that we have. But essentially the activity level is the program type that we are doing. So if you go one step further, and you will find all of these in your Excel document, and I will show that to everybody later on down in the presentation, but essentially it's your budget categories, right? So if you had a resource that covers any of these types of programs, even if it was emergency rental assistance or emergency food and shelter program, you would include those funding sources in the information that's being presented through this process. So we have a couple of activities for shelter and housing stability, just the renovation, and some of y'all got admin and top. For the street outreach, we're going to be looking for essential services. For the HMIS line item, only the folks at Cohio need to worry about that, but they're also looking at the other admin that we put towards the program. Here's a link to the program component quick guide. It's really good visual representation of the activities of the ESG program. So I'm going to stop, and Brooke, are there any questions?
So far, I'm just seeing someone asking if the slides will be sent to them. And I know this is being recorded, so they'll have access to that, right?
Yes, we will post all of the materials to the OCDTA site. And I'm going to walk everybody through where to find those, but we will send that out and the recording. Thank you, Brooke. All right. I'm going to go ahead and keep moving along. So there's some considerations that we had to take as we're going through this process. One of them being that, HUD issued this guidance in May 2022. So that's, and you guys are just getting this training right now. So we recognize that, we need to go back and do all of this just for the paperwork, but we get that you all were not notified that these changes were needing to be in place, or some of you were and were already doing some of that. But I do want everybody to remain calm about it. I've talked to HUD, I've talked to some TA folks, and we're sure that we get this paperwork done, we're going to be fine. I don't think the benefit has been duplicated. But I do want to mention that some of the decisions that we're making through this process is whenever we do not spend all of our federal resources, there is a finding issued by HUD, right? And the intention of the CV program was to add to what we were already doing. So it's about getting extra staff or having the additional flexibilities, right, that were in place for ESG-CV. And that is all completely fine, right? We just needed to have a process by which people were getting diverted to each program. And we will talk about that when we go back to that other slide. What I do want to iterate is that it's, when I say that, it makes it sound like this has something to do with the order of priority. For example, that you were supposed to spend this one first, and that's not the case. It's just when we have another resource that may have went completely unspent, but we spent the ESG-CV, when that occurred, we thought in that moment at time that this was going to happen in our communities. You know, the pandemic happened. We were all unsure of what was going to occur, and we were all working really, really hard just to get the money out there and save our neighbors, right? And keep people off the street. So I don't think that it has to do with you had to spend that first. That's not it. But moving forward, I want to keep sure that we're thinking about ESG-CV as something that's an addition to, right? Or we put folks into that because they were over the income guideline. Now, what I will say is that the Emergency Solutions Grant funding from 2019 and 2020, there was an opportunity for states or other grantees to go through and input information in IDIS and classify certain amount of funding to prevent, prepare, and respond to coronavirus. So we did go back through and we did ask for that. So that has been taken care of through it. Another thing that may have, you know, had us leaning toward ESG-CV too is the fair market rent waiver. And I've not got a response yet from HUD about that. That was a waiver that went through March 31st and made fair market rent, us able to go above fair market rent as long as the unit was rent reasonable. But the 2019 and 2020 funds can do that as well. And we have the Ohio Housing Trust Fund match the Emergency Solutions Grant Program. So we have those follow the same rules so that it can be used as match. So with this process, you know, both with the client and at the budget or activity level, what we're going to do through this process is what we do every day, right? We're going to look at what our total need is. We are going to determine what kind of assistance is needed. And then the maximum of the award needs to be in alignment with those things. And then we take those documents that you guys are turning in, we analyze them, put our assessment on there, and then HUD can monitor that when they're coming to see how we spent these funds. So I want everybody to, because this process should have happened at the time of funding and at the time of any amendments, right? So we're, sorry about that. We would base our information that we're providing there on what was occurring at that time. So what we're missing here is some of those other resources. So what you're going to send to us is what I thought my need was when I applied here, and what were the resources that I have, and that should have been the maximum amount of the award that we gave out. So in the presentation, when it gets sent out, this is our HUD guidance, and HUD also made a sample client file for the duplication of benefits. So there's a sample there. So, and we'll go click through the TA site later on in this process of this training. So what's going to happen is I'll all the staff are going to input into Salesforce, these documents, and you're going to get those just like you would a grant agreement through that process. So you're going to receive that email with the documents, and you're going to work on completing the forms for duplication of benefit. You're going to complete the forms for recapture, and you're going to send it back to the email listed here on the slide within 14 days. And in the policy, it will outline the order in which we're going to go by the order that we received it, but we'll also be prioritizing. So for example, if somebody has a HCRP grant that has a really large balance with ESG-CV, that's something that we're going to look at first so that we can get the dollars out the door as soon as we can. Oh, do we have Letitia in the meeting?
No, I don't see her as joined yet. I sent her the number and I haven't heard back. And I don't see her in the list.
Okay. So we will go through these forms. So this is the point in the presentation that I'm going to need to switch over and share my screen instead. So. All right. So can everybody see a Word document?
Yes.
Yeah, and it's obvious, guys, this is my first WebEx, so thanks for hanging in there with me. This has been a little bit of a bumpy ride. All right, so I'm gonna take us all to the OCD TA site and show how you can get to these forms outside of the email that you've received. So you would go to the OCD TA site. We go to grant application and implementation information. Up here, you can pick your program section. This is supportive housing. And then anything that you guys are going to need, any kind of policy changes, everything related to documents that you need to fill out or an application, it lives here on this page. And we've linked to it. So here's the duplication of benefits policy up here. And as you go through, I want to point out that there's a download button here. So if you don't have, access to Salesforce, usually you can just hit download and then it's going to pop up on your screen. Then you will enable the editing and be able to fill out what you need to fill out. So here, what I had pulled up before is the subrogation. Oh, here's the acknowledgement form. So, and we will date these for the date that, we did them because it occurred when it occurred. And then you'll answer the questions about whether or not, yes, not funding is sufficient to cover the project. Or yes, the funds are adequate to cover the project and a gap has been identified, right? So that means we still don't have enough. Or no, like if your answer is no when we move forward, that's not the answer we would be looking for. And I just want to remind everybody, like, these forms should have been done before. So because I thought that I was going to spend these ESG-CV funds and then maybe there was no housing in my community, to put folks in for these extra resources. I just want to draw your attention to that because you want to be looking at that point in time and be sure that, you're not saying no. If you applied at that time, there was an assumption of need, right? This is asking you to verify whether or not you've used the calculation worksheet. We have a subrogation agreement too, that was also used for the CDBG-CV program for those of you that had that experience. And then asks about the duplication with the grantee and that you recognize that this is the policy and you cannot duplicate the benefit. And if you were to duplicate the benefit and use the money twice on the same thing, that you would have to pay that back. So you'll sign that and send that in. We also have the subrogation agreement. Again, this is just a copy of what we did with the CDBG-CV program. I would recommend doing this after you've done your duplication of benefit worksheet. It will kind of help you be able to answer those questions. Pat also pointed out you can get to the TA site from the Ocean Help. So when you log into Ocean, you have up on the top right-hand side the ability to go directly to the OCD TA site. It's also linked within the document as well that you guys are receiving. So when we go to do the duplication of benefit, it is landing on the grant manager analysis screen. Whenever we upload these, they land on the screen that they're on when they get uploaded. So what you guys probably will need to do is down here on the left-hand corner, there's 3 little dots. You're going to keep clicking that so that you can see the duplication of benefit worksheet. So if you have an ESG grant, you're going to fill out this one here that says ESG on it. If you're a HOPWA grantee, you only have to fill out this one. So these are pretty self-explanatory. With the component and activities, you'll probably need, in a previous slide, I linked to a really good visual from HUD that's really helpful too, so you could use that. But we also put it in here in this activity by component. All right, so you can see your component types and what your activity types for what you are requesting. So we're going to put what those are. We're going to go to this drop box if it's new or existing. This is how much you had asked for in ESG-CV. This is what thought your total need was at that time. Here are the other resources that you will have to put towards those, and just put a narrative in here about where those funds came from. And you will include the funding that you receive from us, either through federal ESG or Ohio Housing Trust Fund. So regardless, the Homeless Crisis Response Program funds definitely need to go in there, as well as any kind of ERA funding that you had. This will auto get done for you. We've got these locked. So it should just pop up. And then you can check over here, to see and check yourself for errors in regards to, you wouldn't have a request greater than what your need is. Okay. Any questions, Brooke?
Yes. From Reagan Claypool, they're trying to confirm if the duplication of benefits process is only for ESG-CV funding rather than for ESG funding that came from Ohio Trust Fund dollars.
Yeah, so the reason why we're doing the duplication of benefit is because HUD issued guidance in May about how their coronavirus funds had a duplication of benefit policy that had been added to it through the act where they established these funds. So the reason why we're doing this process from the lens of, this is my ESG-CV request. Where the Ohio Housing Trust Fund dollars come in those are other resources that you all have to go towards these costs. Does that make sense?
Yeah.
Okay, we're good. All right.
And then Marty was asking if they're required to do the DOB acknowledgement for all ESG-CV clients that received assistance.
The duplication of, so it is not my expectation that we're gonna take the HUD form and use it. That's not the expectation here. We've been doing this grant program for a really long time. It's possible that we will not be able to track down some of those clients. My thinking, though, is have you look at that form and look at it from the lens of, have I asked this maybe in a different way and not in one form? Because part of determining if somebody has enough resources or support networks and would otherwise be homeless, we do take a look at what other benefits somebody's receiving. So we're already doing that process essentially there. And I think most of us have, something in our files. So check and keep sure that there's something in your files that's telling people, if this is untrue or if you already got assistance otherwise, for the same thing. And usually we're asking that. If you've not been asking those two things, when HUD comes and monitors, they're going to pull some files and they're going to look to see that we've checked that they didn't have a duplication of benefit. So I want everybody, this is kind of individualized in the sense that everybody's forms are different in Ohio right now. So, and I've not seen all of them, but I have seen a few, and it's looking like we're asking those things, but not specific to it. So if we find out that a client did duplicate a benefit, it's definitely in our responsibility. And I know that we would do that anyway. We would manage that, and the landlord would have to pay it back, or, something like to that effect. But I don't encourage folks to just print out this form and try to go find every single ESG-CV client that they've seen in the past 3 years. I'd like for everybody to look at the form and assess whether or not we actually did do that, just not specifically in that way. All of the HUD training points to a code of federal regulation that we all were governed by anyway. So the duplication of benefit didn't get a lot of TA going out because it's already sort of part of our processes. So before anybody makes that decision, I'd like us reaching out to our grant manager, expressing the concerns about it and us working our way through what we think we need to do versus, keep just everybody going back and trying to get every client to sign this. What I will say is that, HUD will come along, and if a client had duplicated a benefit and we didn't do anything, I think that's going to be a serious concern that they're going to have. And they will have a concern about this not being at the beginning of the grant program. But we recognize here at the development that you all are just receiving this information. So take a look at your client file, keep sure you're not already asking these. And then if you need to add in what's missing, from the duplication of benefit into those files, and starting from this point on, we want to keep sure that that's getting signed and can be pointed towards in a file. Does that help? I know that's kind of wishy-washy, but I think that everybody's going to be in a different place with that. Does anybody have any specific examples where you guys think that you're collecting this that we could share with the group that would be like applying this, that would be helpful? Okay. All right. Brooke, am I getting any feedback in the chat?
Yeah, I think Marty, she said it doesn't help. I think she may need further clarification on that question.
So what I want us to do is take a look at our client file. So let's go here. Let's apply this. Right. So what I want everybody to do is take a look at, does your client file already, and I'm feeling like it should assess whether or not somebody else, if they're getting assistance from any place else, right? So that's what this part is here. So what I'm saying is look at your file and figure out if that's already in there some other way. If we did not ask any of this at all, or if we didn't, we should probably make some attempts to get that, but I know that it's going to be very, very difficult to do so. And we are really busy. So I want you guys having this discussion with us about, if the file is meeting these needs. And because the key here is, are you getting other assistance in agreeing to pay back if they do? So moving forward, yes, every client gets this. Moving backwards, let's assess whether or not you're already asking this. And if you would like to send, something to us like this is this okay? That's fine. We can provide those, but be looking, because we do already do some of this. Like if you've already got assistance, you agree under, penalty of perjury that blah, blah, or, and I'm not saying they should say that, but that it's being shared. If it's not in your documents at all, we'll have to come up with what's a reasonable plan to be able to do that. But I feel that most of our files assess that. If they don't, then let's do let's talk to our grant managers about it and see if what's feasible and not feasible. It's not my intention to have our grant managers, like, we know what's happened. So it'd be an observation of, this did not occur. Can it be rectified or not? And just go from there. Any other feedback, Brooke?
Yes. Jamie Rice wants to know if filling the DOB worksheet out is a requirement for all CV grantees.
So the duplication of benefit, the types of questions are expected to be put into the file. So any program participant moving forward, if you're not asking them if they're receiving other assistance for the same thing already, then yes, you're going to want to do that. We are not requiring that anybody just adopt the form. You can adopt the form if you want to adopt the form. If you already have something to that effect, then it's not necessary to, HUD's not going through and specifically looking that you use their form. They're keeping sure that we didn't have a client duplicate a benefit and that we at least looked for that. So in the file, usually we look for what other programs are participating in with this client, and we kind of coordinate that. So no, the form isn't required, but yes, we should be assessing whether or not that person has already received assistance someplace else for the same exact thing. And yes, we should be having something in our file where the client agrees that they're going to pay it back if or the landlord is going to pay it back if they're duplicating that benefit and collecting that money twice. So no on just adopting the form. If you have asked this, just not this exact way, then I think that's fine. And no action needs to be taken. Now, if you look at this form and you're like, oh, we don't even, assess whether or not somebody else is already getting something someplace else, then that needs to be a conversation with the grant manager. And we want to fix it now and get that into the file and talk about what's reasonable in terms of going back. But we're not requiring that at that point. I think that needs to be a conversation, and I think that's really unwieldy.
And Marty also asked, how are we to know if another organization paid within our region that was not included in the region level ESG-CV?
So I think what she's asking is, like, what are the steps that we need to take to coordinate with the other funding sources and programs that are in our region? So, I mean, I would, or is she, Marty, are you asking about, is there another region that maybe serves you and maybe they're not participating? And so that's how we aren't aware of it.
I can unmute her and have her ask her question for both of you.
Thank you.
Okay, she should be unmuted now.
Good morning. Can you hear me?
Yeah. Hi, Marty.
Hi. Yeah, my typing skills, I had some typos in there too. So yeah, what I'm looking at is throughout our region, community action agencies receive the other treasury dollars. And that being said, though, they are not in our partnership specifically for our direct rental assistance, whether it was our ESG-CV or our HCRP funding. So that being said, they are outside of our realm of what we would see if they've spent any of the COVID relief type of funds. We wouldn't have access to that. The client files wouldn't be filtering through one agency, that type of thing.
Okay, so it's not the expectation. So when we're talking duplication of benefit and we're talking about the ERA funds, right, through community action, it's not the expectation that wouldn't show up in any of the other stuff that you're doing. Where it would show up is this program participant duplication of benefits evaluation. And usually this is what we would call but for this assistance back in the HPRP days, right? So, but for this assistance, this person would be homeless, right? So we're assessing whether or not through that client, like we do have some talks that we're going to have about this, about how some communities have partnered to do that and have that coordination between the community action agency and the homeless program agency. That's definitely that's what that slide was back there, is about how we can know those things and work towards that. It's not my expectation. Like, you're not going to know specifically that this client had gotten ERA for community action. That's not expected that you have a crystal ball and right. You don't know that necessarily. The program participant could be possibly untruthful on here, right? But what the point is that we've asked that if they've gotten if they're getting assistance from something else, so that we're coordinating and not paying the same thing. In an ideal world, I would really like to see coordination amongst those agencies. And sometimes it's the same agency here in Ohio, but half the time it's not. So forming those partnerships is helpful, and finding ways as a community to filter, this is what I have, this is what you have, and we would do that maybe on the local continuum level, which is not required, right? So maybe you do that through some other board that you participate in. Oftentimes we see a lot of the same people and are trying to, we'll pick that up in other ways. So the expectation isn't that how much money the community action agency got for ERA, and the expectation isn't for you guys to have to look that up. It's just, did we ask the client if they're getting other resources and support networks, and did our file let them know? If they did, they'd have to pay it back.
Yeah, I was just going to clarify.
Thanks, Pat.
Yeah. So as part of your assessment of a client, you're going to see whether resources they have access to, whether they try to get those resources, whether there's a need to assist them with your funds. I would look at it that way on the client level.
Thanks, Pat.
Yeah.
All right.
Do you want to keep going through the questions, or?
Oh yeah, if they're pertinent to this, let's go ahead and handle them.
Okay. We've got a lot. Nicole Spooner was seeking clarification on when they're, I'm sorry, not Nicole. Oh, sorry, this is moving fast. Krista Kidney And yeah, Nicole Spooner, they're seeking clarification on the worksheet deadline. Is it still 14 days out from the email they received?
Yeah, you will get these through Salesforce. So it'll come to you in an email, likely from Stephanie. And once you get those, that's when we're asking to get those returned. So we have to do our part first, and that's why everybody's ESG-CV grants are still open, even if all the funding is spent, is so that we have the potential to do that and track it through our Salesforce database system. And we next we will go through the recapture form as well too. So, Brooke, are there more questions in there?
Yes. Amy Anderson asked, what grants would you have had to receive for us to fill out this information?
If you have an ESG-CV grant, it will end in a -4 or a -5. So if you were invited to this meeting, it was because you have a grant that was funded through the ESG-CV program. That happened in program year 2020. So there was the regular application, and then later down that year, there was, I don't know, I think it might have been around August where we all applied for the funding. And that was the timeline of that grant. So, but everybody who was invited to this was in the ocean system being attached to a ESG-CV grant. So they will end in -4 or -5 because none of our other grants in that way. And that's the way to know which grant we're talking about. Next question, Brooke.
Yeah. Nicole Spooner said, is this applicable to us if we propose the ESG-CV funding be used for a completely separate purpose than our existing HCRP funding?
Yes. So regardless, I do need everybody to at least complete these forms if you receive that money, period. Right. So I talked to the TA person from HUD, and they just told me to just go back. So if you never got an amendment, you're going to do this once. If you got other amendments, we would, need to assess it for those. So everybody should at least have one that they have to do. And then moving forward, if you're requesting the funding, we will have to update the worksheet, just the Excel file. So we just sign the forms once, right? But the Excel files, we have to reassess for every time. So when it's for an activity and component that you don't have any other resources for, that makes it really quick and easy to do. 0, 0, 0. And we're pretty much done, but we have to show that we've asked you guys if you have these other resources. And there wasn't the focus on that. So even though we had ERA funds or HCRP, maybe that wasn't included as leverage because we didn't guide anybody to do that. We found out in May about how we should have done it differently.
All right. Margaret Wise had a question. She said that they don't provide rental assistance. They only provide shelter. They received ESG and ESG-CV funds. They use cash donations for match for their ESG grant, and there is no match on the ESG-CV. She's wondering how this pertains to them.
It pertains to them because anybody who has an ESG-CV grant needed to include in their leveraged funds those items. So because we didn't have that handled on the front end, we do have to go back and do it.
Okay. And then just another confirmation question. All shelter clients need to have this form filled out.
Yes, this applies, well, no, not to a shelter. So in this, on a previous slide, we kind of outlined for everybody. Here we go. DOB analysis by activity, right? So that's where you know what applies to what, right? So emergency shelter, like a homeless client can't be in 2 shelters at once. So that would be extra work. So you don't need to do that. If you got a top grant for renovations to a shelter, you just do it at the activity level, right? So you do it just for that grant. What other resources were there? And then where it comes in for the program participant is only on the rapid rehousing and homelessness prevention side. All right.
All right. And then another confirmation question for the due date. When do the 14 days to complete these and return them start?
When you get them via email.
There's a question from Deanna Cool. She said the DOB certification worksheet ESG spreadsheet only shows one section and no fields can be selected. Are they supposed to handwrite in answers?
No, so only certain fields are locked. So if it is white, you should be able to fill it out. So agency. So you can fill that out. But when you get here, we've got it locked. So we may need to enable the content. So when you go to download it, it'll take you to this link in Salesforce. And it kind of looks like you can't download it, right? It'll show this black screen. But when we download it, pull it up, we should be able to, fill them in if it's white. But, we haven't put color on it, that means it gets filled in. They shouldn't be locked all the way. So if that continues to occur and she can't reach out to your grant manager and we can help you through that.
All right, and then a question from Melissa Wright. If we are a shelter and used all ESG-CV funds for operations and have spent 100% of our funding, do we still need to fill out these forms?
Yes. Everybody has to at least do one for every time. And I understand that, this is a heavy lift and I apologize for it. I know how that feels, right? So we just have to go back and show that an assessment was done because we did not include any of the other funding in the assessments of what was being put out. So I recognize that some folks have been done with spending this money and they've been done for some time. There's also, the issue with, we could not put out anything through Salesforce and keep that tracked without having that grant open. ocean's in a very fragile state right now. So we are all having to baby it, unfortunately. We're in the works of migrating to Salesforce, but unfortunately, it limits us in many, many ways. So I did talk to leadership, and we're going to be able to close these out, but not until this duplication of benefit assessment comes in. So you would just still do it, and you got your state funds. You put those, if you only had, the HCRP funds from the state and the ESG-CV, you just put those in. You've already spent it, right? So a lot of what you'll be doing is going to be real quick, just documentation that you did not have these other resources. And those forms, they're required. We should have had everybody sign those on the front end when we sent out the grant agreements. So those do need signed. Regardless of the scenario, we have to do these forms. So I've been told that Letitia is here. So Claire, do you want to make me not the presenter, and then we'll revisit these questions after Letitia and Toledo and Columbiana County speak?
Yes, so Letitia, you should be able to speak now.
Good morning. Can everybody hear me?
Yes.
Awesome, awesome. So I am calling from my phone. I'm in Washington State right now. So I'm like 3 hours behind you guys. So I did wanted to, take the opportunity to talk a little bit about the Home Relief Grant, which is the Emergency Rental Assistance Program, ERA2. So a couple of things I definitely wanted to highlight for the ERA2 program. One, this program, of course, is for individuals that is in need of emergency rental assistance for past due and also future rental costs. Just to back up a little bit, the ERA1 program came to an end on September 30th, and we just actually wrapped up our final report to Treasury to provide them with a recap of all of our program results and expenditures for that program. So the community action agencies have received an allocation for the ERA2 resources. And then also, so customers can apply in person. And so what I would recommend is for, depending on what county your customer is in, to reach out to their local community action agency to find out what their walk-in procedures are and how they can apply. So that's one option on how customers can apply. The other way customers can apply is through, they can apply online. And if they go to development's website, there is a link where I want to say it's Home Relief Grant that they could click, and it will guide them to the online platform where they can apply online. They would need, it also on the website indicates the documentation that the customer will need in order to apply online. The turnaround time to apply online, and this is pending if the customer has all of their documentation available, is about 21 business days. I will say if the customer does not have all their information at the time that they apply, that will cause some delays. So the online platform works similarly to the Home Energy Assistance Program online platform. So if a customer has applied online for HEAP, they can use that same username and password credential to apply for the Home Relief Grant resources online. And so let me see, trying to think if there's anything else I wanted to highlight for the ERA2 resources. I will also say that there is a month cap on those resources of 18 months, and that's for ERA 1 and 2 combined. So in other words, if you have a customer who have applied for ERA 1 resources and have received 12 months of assistance, then the customer is only eligible for another 6 months of resources for ERA2 until they reach that cap, that 18-month cap combined for ERA 1 and 2. And that's pretty much high level overview of the ERA2 program. I know that there's a lot of questions around arrearage eligibility, things along those lines as it relates to House Bill 45 that was approved. So what I will say is that the current resources that agencies have, and that is currently online, or as far as customers applying online, does not apply to the resources that's currently circulating with our agencies and our online platform. So in short, House Bill 45 has a requirement where arrearages prior to December 31st of 2021 is not eligible. So saying that to say that the current resources that that the agencies have currently, that is not applicable. So if you have a customer who has arrearages January 1st of 2022 and beyond, they can still apply for ERA2 with the current resources that we currently have. So I will stop there to see if there's any questions from me as it relates to ERA2.
Brooke, are there any questions?
I think I saw one. It asked if there were any resources left, and the answer is yes, there are. We still have resources left in the current ERA2 resources that we're using now. So the answer is yes, we do have resources still available. And then also the community action agencies, again, we've given them an initial allocation, and we have also informed the community action agencies just recently that if they need additional funds out of the current spending authority that we have, they can request additional funds. And so we have had agencies take advantage of that and ask for additional funds.
Right. Well, if there's not any more questions for Letitia, I'd like to thank Letitia for coming and talking to us about this. And she needs to get back to her conference, I assume. So thank you, Letitia.
Sure. There's one other question. I think it was from the same individual. It says, I'm like multitasking on this phone. Let's see. It says, we have already gotten a second round of that. Would we be able to do it again? And the answer is yes. So you would just, assuming that this is coming from a community action agency. So you would just submit your request to the your assigned field rep, and give them the answer, give them the response that you gave them before, the amount that you are in need of, how much or whether how long will these additional funds cover you. And I think there was one other question. So you would just do that same thing for the field, and give that to your field rep. And then what we'll do is review it just to make sure we still have those funds available, which right now we do, and get that to leadership for approval, and then of course notify you to do a budget revision for those additional funds. I think those are all the questions that I saw in the Q&A for ERA 2.
All right, thanks, Letitia.
All righty, you guys have a good one.
You too.
Bye-bye.
Hey guys, I am unable to right now, but we are going to figure out how to put into the chat the link to the home relief grant. We're getting a lot of folks are getting referred directly to me for the home relief grant. So I just want to draw everybody's attention to, I think I can't put it into the chat right now because I'm presenter, but we'll get that
Just
into
put it in there as an answer to someone's most recent question, but it should be in there now.
Okay. So if you guys direct folks to that website, they will get a 1-800 number. If they get sent to the OCD website, they've been landing on our page about our funding, where we provide funding to you all. But I wanted to share today so we could start directing our clients directly to energy help at development.ohio.gov. Some folks are confused about it saying energy help, but that's the mailbox that that have staff that are monitoring that and able to get those applications pushed through. Vernon has been working very hard fielding, even up to 26, emails from homeless folks a day. So if we're referring off to home relief grant to directly get rent assistance, we want to be using that website, that email address, that phone number, because otherwise they go to the OCD mailbox and then to me, and then they either then they go to Vernon or out to Energy Help. So, Claire, could you do me a favor and unmute Marty? Marty, I'm going to have you talk about how you're kind of funneling managing the ERA versus having the homeless dollars and how we're partnering those up to make that work.
Can you give me a first and last name?
Marty Grimm.
Okay. Yep, they should be unmuted.
Martina.
Hey everyone, how are you? Our agency in Columbiana County, we serve as the regional lead for Region 6, which includes Carroll, Harrison, Jefferson, Tuscarawas, and again, Columbiana County. As an agency, we have been administering also the ERA funding, which has always been confusing from the get-go, as we have so many different names for the ERA funding. So many times we're calling it the CAA HRG, and then the ARPA HRG, and then the state level, I believe, are calling them ERA funds. So it gets a little confusing for all of us, including program staff, but we're making it. That's the life of COVID, right? So as an agency, we had elected to implement the ERA/CAA HRG types of programs within the same department that houses our homeless prevention programs. Those programs would all then fall under myself as director of the department. So with that, we had put a process in place of screening clients. So as they were requesting assistance, the screening then was to identify the best program for them to receive assistance through. For instance, we not only have the traditional Homeless Crisis Response Program, or HCRP funds, but we also have funds specific to youth and young adults under the age of 24, and also the veterans under the supportive services for veterans programs. Those programs come with much more intense case management due to the multiple barriers in lieu of basically very little case management and just direct financial assistance, sort of such as what would be provided through that third-party vendor being utilized for the ERA too. So by doing that, a couple things would have occurred. One, we would be ensuring that there is not a duplication of benefits because the same staff members are the ones that were reviewing files and then determining which program, whether it would be ERA, HCRP, I'm sorry, our ESG-CV funds, again, which one was the best fit. If there was a COVID type of hardship, again, the direction would go one way. If the individual was a veteran, we may have provided intense case management under the supportive services of our veterans' families, but then we would make the determination which funding source would be used for the direct assistance. Again, if it was a COVID-related incident, then we would have utilized CV type of funds, or potentially the ERA funds. Again, it always depended on the unique situation of the household. So that worked well for us. But then I also know that other agencies, even within our region, did not place the ERA funds within the same department as their ESG and traditional HCRP funding. Also, in our region, we have a variety of entities that partner as access points for the programs, but those are not always the community action agency that serves that community. So in some areas, a community action agency may be then administering the ERA type of funds when other organizations are administering the ESG slash HCRP type of funding that we've been discussing, including the ESG-CV. So that created a bit of a disconnect, probably not only in our region, but many regions. So I did reach out to one of the community action agencies, so another partner agency that is administering the ERA funds, to discuss options on making referrals to programs such as the veterans programs or our youth-specific homeless services or the ESG types of funds based on what they were finding, so they could provide those resources to those individuals that would apply, but potentially not eligible or the best need under their ERA program. I can't say that worked. I think we had providers that maybe weren't doing as much with homeless prevention because we did not get those referrals that we had anticipated from agencies that were not also implementing ESG or HCRP funds. Does that mean some people went unserved? We're not sure. We're hoping they would have received the direction to contact another access point so they could utilize the ESG or HCRP types of funds. That right now too, when we have a third party, hoping that that third party, the design of that program is, if someone is not eligible under those programs, that the referral is then going back to the access points for the ESG-CV or HCRP funds. Or again, are we now creating a system that people could potentially fall through the cracks because of the lack of referrals, I guess I would say. So internally, we struggled a bit on what funds to prioritize. I know Christine said, oh, it's not really a priority. It's truly which program is the best fit based on the participants' needs, barriers, and eligibility. We maybe didn't do the best on that. We did say, okay, we're going to look in a silo and spend our ESG-CV funds first because they had the first expiration date, and then that was extended, and then we switched hats and went to the federal ESG under HCRP, and we thought we went into it with a plan in place, one that would continue serving everyone, but we found that we had then funds remaining, and that was always my concern. Been around 25 years, so I anticipated when the volume of funds came in, where my concern was that there would be a focus to spend all of the pandemic funds that were sent in response, whether it was ESG-CV, whether it was ERA funds, whether it was the variety of youth programs and veterans programs that increased their budgets because of additional funds received, whether it was through Treasury or the VA and so forth. Because my concern was then we would not be able to document the usage of our HCRP and ESG funds, and that would affect us in future awards. And again, that is what happened when we were unable to expend our ESG traditional funds. I call them traditional because those are the ones we've been utilizing. And to me, it's been concerning that at that federal level, potentially they could look at that and say, well, is the need there? Well, the need has been there. There was just additional influx of funds. So again, we've worked hard to do the coordination. But again, to take, as Christine had mentioned, don't look at it as prioritizing, but by lining up the variety of eligibility requirements and available funding to funnel the individual of what's their best fit, but at the same time taking the step to understand that although you may be paying for direct client assistance under one of the programs, that individual could also receive additional case management services under a variety of other programs. So you're still meeting your goal of expending your ESG funds, but they may be able to get additional case management service from providers that have funds for targeted populations. So again, it's not a band-aid of just direct financial assistance. It's looking at the long-term barriers that they have. So I hope that touches base on what you were looking for, Christina, and hope it gives some other guidance.
Yes, thank you for sharing your experience, Marty. I also have another speaker from an agency lined up, Michael Hart. Claire is on this call, and I was gonna hand the microphone over to him for him to talk about.
Yep, I've unmuted him.
Hello, everyone. Hi, Christina. Am I good to go?
Yep. Oh, and let
Right.
me, before you go, I acknowledge it's 11:30. So if people have other things to get to, we are recording this. I apologize. This is obviously the first time I've done this, and you guys have really had a bumpy ride. My apologies. But this will be recorded if you have to go on. Now, Michael, sorry about interrupting, but
No worries.
I should handle that. Yeah.
Yeah, I will try to be brief. But in Columbiana County talked about some things that we're doing here in Lucas County. I'm Michael Hart. I'm the executive director of the Toledo Lucas County Homelessness Board. We're the Continuum of Care's lead agency, collaborative applicant, and HMIS lead for Lucas County, Ohio, and Northwest. Toledo being our largest city and our participating jurisdiction that received the bulk of the ERA funds in our community. I also serve on our community action agency's board of directors, so I have some understanding of how we've moved funds with our community action agency. We received and have allocated a significant portion of between the city and the county, and this includes the money with Pathway, our community action agency, approximately 42 million, in addition to a recent award that we anticipate will bring another 34 million to our community. The way that's been set up from the get-go, the county and the city chose to combine resources and create one portal that you can access remotely and online. Two key partners within our system were brought on to provide case management and additional wraparound services under the housing stability piece of ERA funds, to really move the rental assistance, the utilities, and security deposit dollars throughout our community. Obviously, our community action agency was a third leg of that stool, along with NeighborWorks of Toledo and Lutheran Social Services. And the community action agency has the addition of home relief funds and the HEAP program and PIP and so on and so forth. So there was ways to really integrate their other resources in addition to workforce development opportunities and the Financial Opportunity Center. Where we really came in is, while we were able to now divert a significant portion of those presenting as at risk of homelessness or literally homeless, we were able to divert to these robust resources. Our staff at the Homelessness Board, through managing the coordinated entry system, are part of the ERA fundings as a granted partner. And what we do specifically, of course, we seek to divert to the Neighborly software to try to utilize those resources on the front end and preserve, and that has allowed us to preserve our more finite resources through the COC program or HCRP. But we've really sought to do more in terms of diversion. In addition to that, we've built a housing problem solving program at the continuum of care level. So we have been able to match with the ERA funds some flexible general fund monies from our county, the ESG-CV, HCRP, and other resources to really create a flexible, nimble program that focuses on prevention, diversion, and rapid resolution. Whether or not you're just at risk of homelessness, you're in a shelter, but maybe not moving towards prioritization quickly enough, or even at the back end of the system when we have significant barriers, these resources and the different tools, by combining them together, has allowed us to be really creative in how we approach that. The vast majority of our staff in our housing problem solving program, which includes a fairly significant eviction prevention component that pulls in about 15 different major stakeholders throughout the community and leverages different resources, including legal services, landlord-tenant mediation on a pre-litigation front, financial opportunity centers, our school districts, our mental health system. We've really got a really good collaborative around eviction prevention. And our team, sort of with the ERA funds, serves as sort of a glue in between all of these different programs. We provide services around case management and housing navigation. We provide services around landlord engagement. And we have somebody on staff who literally every day is meeting with landlords and building relationships in the private market, and building out tools that we can incentivize landlords with. And of course, we have somebody focused specifically on eviction prevention who coordinates between all those different partners I mentioned. So we really have been able to build with those housing stability services a really comprehensive team that can meet folks in the middle. So if the ERA program is not enough to get that individual to a more stable place, then they can come down to us and we can triage the other parts of that whole picture. And we're really excited about this because we're really trying to build a continuum that allows us to stop homelessness in its tracks earlier, and again, really be able to prioritize our resources from other sources for other reasons. And among those things that we've been able to do is looking at HCRP or ESG-CV and seeing how we can invest more in staff and other housing stability services when we have these more significant resources in terms of rental assistance. In addition, the ERA funds have allowed us to leverage TANF funds from our local JFS as well. So we've been able to reimagine and reposition how we structure programs, how we structure staffing, and just how we set up our system. And it's worked really, really well. It's created a more seamless system. It's created an environment where there's no longer a waiting list to resources necessarily that requires you to get worse to get help. So that's really what we focused on, is using that as a resource that is parked upstream, building the capacity to move people toward those resources and build out the other components of the continuum and better leverage and utilize existing resources. Christina, is that what you want me to say?
Yeah.
Okay.
Thank you. Thanks, Michael. I just wanted everybody to hear, because we're getting a lot of resources in, so it feels like it's raining rent all over the place. And that's why we've removed some of those caps on what your services could be. So I just wanted to mention, that we would love to see how these can work together. And one opportunity where that becomes really easy is these HUD requirements are so much more than a lot of this pandemic funding. And that's obviously, where we went to keep sure that we were spending those resources as well. And the guidance had been from this office, previously to spend the CV first. So I just wanted to share these stories because we're kind of departing from that, and we're saying ESG-CV was to add capacity to what we were doing or helping us serve more people because of the pandemic. So as these, rental assistance programs come out, you could be partnering with, I think there's 10% of the funding that can go to staff under ERA. And you don't have to do an inspection if you've got a homeless prevention client who, isn't going to have ongoing rent. So if we're just paying past due rent, that's an opportunity there, right? If somebody is able to get the rent assistance from ERA and then the supportive services here. And in that instance, you don't have to do the inspection. If you do partner these fundings, you do have to do the inspection though. The only exception with the, ERA is going to be that homeless prevention component where we don't have to do that as well. So thank you to our presenters for helping explain this. I really appreciate you guys talking to everybody about your experience. I'm seeing some questions in here, and I'm planning to get to those. I want to finish out the presentation for everyone first, and then I can stay on here and answer questions until everybody feels comfortable that they understand. So I'm going to go ahead and re-advance us back to here. So the duplication of benefits process, that is all about, we needed to do some additional assessment on our end that didn't happen. And so we are going to do that now. With ESG-CV recapture, that is to be a snapshot of what's happening right now versus the duplication of benefit, looking at what happened at the time of application or amendment. So I'm going to share my screen. And go over the recapture form. I know we got lots of those. We put out the materials first because I was wanting everybody to see the duplication of benefits forms and be able to ask questions of us today and get all of the clarifications out. And, I know you guys will have input for us as well. So a lot of this is pretty self-explanatory with this, so I won't go over that, but this section here is for return of funds. So those of you that have ESG-CV left over and you are not going to be able to use it, you would put that here. And you would not need to keep going, right? I know that I'm unable to spend these funds. Let's return what I have. And what we will do on our end is we're going to have to process amendment, taking the money out. And then at that point, you could submit a final report. If you're wishing to keep the funding or requesting more funding, you would continue on here. So what the point of this kind of is to explain why what we're seeing in terms of the funds not being spent, if there is a challenge or there's some other fund that you are spending, but it's going away. So that's why your funding hadn't got spent. So here you're going to say, if you even need to, if you did not have any challenges and they're all gone, you're not going to go ahead and fill this out, right? But these are the problems that you were facing. In this next one is, I want to hear how those challenges have been overcome or why things are going to be different, right? I don't want to be recapturing funding if we can't see it on our end because we can pull reports. I can see where some folks are at with their draws, but there could be information that I don't know, and it would not be appropriate for the staff to pull that funding out. So that's what these two cells are about here. And 22, we look at how much money you got to date. That's not an editable field. So you're going to go down here to what you've expended to date, right? So what we're going to see in our system isn't necessarily going to match where you're actually at. And then you are going to project forward. And this should say 9/30/2023. The reason why it says 10/31 is because that's when your final draw is due, right? So all of your work on ESG-CV, we can't expense anything after that 9/30 date, right? The work had to be done. We have until 10/31 to be able to get that final draw into us so that we can draw it down from HUD. You're going to let us know what you think you're going to be spending monthly. Any kind of additional spending that you're estimating. This is automatically calculated for you. And then you'll go down here and provide any justification that despite these appearances, like funding will be spent by then. So up here at the top, if somebody's going to want to return funds, you'll stop there. If you want to keep or continue getting your funds, you're going to fill all the way out. And yes, we intended for this to need to be filled out, right? So what is it? what are your estimations that this is going to cost per month? So you've got these forms, we've had the training, and so your 14 days to return these in has not started yet. We wanted to give people time with these forms. I wanted everybody to have time to ask questions. We recognize, that this was a plane being built while in flight, and this information was not given to you previously. So when those 14 days is going to kick in to get all of these filled out is after you get them via email. We're going to put them into our Salesforce system. It will go out. The email that you guys got the other day, when I didn't realize what an information update is, so that was a new employee mistake. So that was not the email, right? That was an information update that was telling you about this training and giving you links to those documents before the training and having the opportunity today to be able to ask questions. So, let's see here. Blair, can we make me not the presenter anymore?
Yep, just 1 second.
So what's going to happen as we recapture these funds? There'll be a grant amendment that gets done. It'll pull money out. After the grant manager has went through and we've assessed and, looked at where the money needs to go based on the responses and the recapture worksheet. So this is where we get limited by Ocean again. I had hoped to be able to use OHTF to be able to plug some of these gaps right now, but what we will need to do is bring those on later. So that's why all of those of you extending your -3 grants or other grants, that's why that has stopped. So we can assess this and then make a determination where it's appropriate. ESG, we actually had already done because we were so limited with who we could give it to. So ESG has went back, and OHTF will go back to agencies and their grants will get extended if we see that that's where the greatest need is. And then if you have already spent all your state funds and your ESG-CV funds, then we would be giving that money, the ESG-CV money, out to you because that's not available to us. And then later on, we'll go to controlling board with any of the money that, based on the numbers we're seeing, doesn't make sense to go back to. That way we can have some more resources because of this benefit cliff that we have coming up with ESG-CV. And I know, especially, I'm getting a lot of feedback from shelters, that something additional is needed. So that's the intention with that. So I had some discussions, but we've gotten so far past the time. I'm going to go ahead and put this into, we will start having some other meetings coming up. So, and some other discussions, and we will get back together to cover these things at that point in time. So we're going to redistribute these funds right now. We went through a HUD monitoring, and it is requiring that we have HCRP policies and procedures. So we'll be putting those together and sharing those out, and that's going to be done in consultation with the continuum of care. And then we'll be providing some TA to support those policies and procedures and explain things. And then you guys will see us for monitoring as well. So So I'm seeing some questions in here. Leslie asked, does the DOB only apply to clients and participants fund usage? No, it's for both, right? The client portion will be done only on housing stability projects. So if you're a shelter, you're not going to do a duplication of benefit form. But with the rent assistance, you would. And then I've got Christina Dick. Did you still want to be unmuted for a question?
I unmuted Christina if she wants to speak.
We mute yours.
Okay. I think maybe we handled that question. Send us another chat, Christina, if you'd like to be unmuted. Brooke, is there more questions? I know I stopped you so that Letitia could go and then get back to what she was doing. Are there other ones that you saw in the chat that I should cover?
There are. There is another, I think we covered this before, but another clarification question. Do ESG and not CV funds need to do the duplication of benefits form with clients?
I would say that it is good practice in general to be assessing when a client comes through whether or not they are utilizing any other community resources. It's important for that to be part of our process, just to keep sure that we're coordinating the funds and using them the best way we possibly can. And it also helps prevent fraud, and I know lots of people saw this with landlords, hearing this money came out and giving out eviction notices or applying to multiple programs. So in general, we always want to, be protecting our funding from that type of thing. The Code of Federal Regulations, regardless, requires that what we are giving out is reasonable. So I don't want folks to think that they need to adopt this form specifically because it's a duplication of benefits form for the ESG-CV program. But we are going to start some policy discussions at the continuum level. And I think that it sounds like we need to put in some guidance around that a little bit more as well. So I'll keep sure that the new policies do that. In the interim, yeah, we want to assess and keep sure that, we're not duplicating any kind of benefit otherwise, but there's no need to use this form. So let's assess our clients' needs, figuring out what funding that they need and where they've already got some. So for example, client's going to come in, and in part of my assessment, I look at all the mainstream benefits that they are receiving, right? In that discussion, when we're doing that at intake, we should be figuring out if there's other rental assistance programs that they're utilizing as well. We can't pay on top of a HUD voucher, for example. So we would definitely want to be assessing to keep sure that we're lining up all the resources that that client has, both within the social service world, but also their personal life, right? We ask the question, it's up to the client to report that to us. And I think it's good practice for, there to be a warning that you can't lie about, but I would put it in the way that this form does, right? Just letting people know if, fraud is discovered, that it would be required to be repaid. And I think probably more guidance could be needed around what happens when that does, if that does occur. And I recognize that. And we'll be talking about that, and you'll see something come out when the policies do. All right, Brooke.
All right, there's another clarification question from Michelle Kosovar. She said, to clarify, we will need to submit one set of forms for our ESG-CV grant, an additional set of forms for per amendment, and a final set of forms for a top grant.
Not everybody will. For them, yes. So every ESG-CV grant you'll do this on if you had, regardless if you had resources or not. And if you amended, we would do it for then. You know, and remember, we're stating the need at the time that it occurred. So the answer is yes, but that's not for everybody. Not everybody has a top, but it only will apply to the ESG-CV. And yes, it should be done in any grant that is ESG-CV. So all of the tops, they don't end in -4 or -5, but those were a separate process. And I think the folks that did one would know that they do. If you're not sure, contact your grant manager.
Right, and then there's another question from John Jagozinski. He's asking, is there already a redistribution plan for recaptured dollars? And will agencies be able to apply for the recaptured funds if they need additional funding?
So there is the plan. That's what the recapture process is about, is seeing like who can state their case for keeping the funding, or, you know, just get the money that people don't need and get it back. If you guys, and I do want to mention, if you only have like $100 left, you know, let's go ahead and draw that versus returning it on eligible expenses. So we are still accepting applications. The target of opportunity program was deprioritized in our original guidance, and it still is. So I would not recommend submitting a top application at this moment. But if you would like to request an amendment to your HCRP ESG-CV grant, you can go ahead and submit that. You know, I'm encouraging everybody to remember this is about, you know, building our capacity or providing something extra that we couldn't do otherwise for our clients. So if you have an extended, if we've extended any of the HCRP grants for 2019 or 2020, you could use those instead. So we're going to be thinking about that as we go through this process. We have to take ocean into consideration and what it's going to let us do. And that's going to also be framing how that money goes out, whether it's ESG-CV or the regular. So if you do want additional funding, I suggest that you get it in. We do have far more requests than we have money right now. I will say that, but I encourage you, if you know that you're going to be able to spend all your funds by 9:30, you know, that means that the work was completed and at least expensed. It hasn't had to have walked out the door yet, but it has to have been, you know, documented and the charge incurred at that point in time. Then definitely get those in, because I don't want to send any money back to HUD. We were one of the lucky ones when they were getting ready to do the redistribution. You know, I had sent off showing to HUD where we were at, because when we're sending expenditures or some of the pulling from IDIS, which is a system where you guys ask for the money from us and we pay you in ocean, and then we go to IDIS and we tell HUD. So that's what that is. I realize now that I talked about that earlier without explaining, but that's the system where we draw that down. So we'll be moving those funds and getting in there. So I told them about it, and we did get a whopping like $198,000 I kind of laughed about, let's not spend that in one place, but we will have that, but that so far has not been determined. And it is my expectation that more than likely with recapture and need the way it is right now, we want to get that money where it belongs in the hands of the folks that can spend it and get it out the door at that time.
All right. I'm not sure if you may have already answered this. Nina House asked if region leads can apply for EHV funding.
For what funding?
For EHV funding.
Is it possible to get them to repeat that?
ERA too.
Oh, ERA. ERA is administered through the Office of Community Assistance. Letitia jumped on this call today. Those funds go out to community action agencies. And then we also have the ability to have clients apply through the website or calling in to the Office of Community Assistance customer service team. But there is not an opportunity for homeless programs that aren't also community action agencies to apply for ERA. So it's a potential funding source, but not necessarily a funding source that everybody is going to have access to because it is distributed to community action agencies.
All right. And then a question from Kelly Blankenship. If our shelters spent the original grant by May 2022 and then received an amendment later in the year, will we have to complete 2 sets of forms, one for each or just for the amendment or one for the entire amount?
That's a very different time frame. So your resources may have been different at those times. So definitely look at that point in time and take yourself back to that point in time, because that should, when you're communicating all of the funds that you have for the program, it was kind of the funds that came from us, or maybe your community action agency may apply there and it may not. If you're a community action agency that's doing that, then ERA would have went there, but that didn't happen through this process. So and HUD had issued some guidance that there's links to that kind of gave examples of the different funding sources that we needed to take into consideration, and that had not previously been done. So we're going to do it at each time of application. So if you did one amendment, Kelly, in your case, yes, it's the original and then your amendment. I also see a question here about emergency shelter and housing stability. Emergency shelters do not need duplication of benefit assessment on their clients. You can't duplicate that, so that's not necessary. That only applies to the housing stability folks. Any other questions?
Yeah, from Natalie McCluskey, she's asking regarding what DOB forms will need to be returned for an ESG-CV RRH project. Is it only the DOB worksheet rather than the DOB form for participants as well, since that participant DOB form sounded like it was optional if we have other documentation and client files?
Yeah, so the duplication of benefit, the client file is the thing that's not going to go into any of this, right? So we wouldn't worry about turning any of it in. The forms that you're going to need to fill out are going to be sent to you. So you will get those via email. If you get the form, that means we do want you to fill it out, right? Included in that is like an updated attachment B. We put a signature line on that I didn't cover today. But it's just a signature line, so that one's not as confusing as I know these other ones are. But you will get that email, so it'll be clear what you're supposed to fill out. Now, in the presentation and in the policy, it should, indicate that you're not going to sign the Word documents every time, right? We're going to do, we're going to do what's specific to the duplication of benefit in that situation.
Right. And then there's a question from Daniel Flynn. He wasn't sure about when the 14 days start. I think maybe some people haven't gotten the email and some people have, so they're not sure.
So the email is going to go to the person who's been designated as the person at your agency to communicate with us. So it's going to be your contact. The ocean list, the email list was pulled from the ocean database for today's meeting. So you would have got it regardless if you are CFO or, the grant writer and that. So everybody kind of got those. And we also sent it out through the continuums of care as well. But if you did not get it, your grant manager has the information update, so you can reach out to them to get it. The other, but when you don't need to worry as much about like when the 14 days kick in, just because you're on this call, right? Because this had to do with both customer service and it also had something to do with grant application, and maybe your fiscal person would know more about this situation and all of the different funding sources than the program person would. So those 14 days will not kick off until the person who's designated by your agency and the ocean system gets these forms. So whoever gets your grant agreements is the one who's going to get these forms, and that's when it's going to kick in. And I will keep sure that the information update is, I'll send that after this meeting to the grant managers so they have it handy at the top of their email box. But also, I'm unable to share in the chat, but if anybody from my team is able to, these are also on the OCDTA site. That I walked everybody through how to get to that specific area. It's under the supportive housing section, under the grant. Was that helpful enough? I feel like I should share my screen there. Is that good? Or
yeah, I posted the link in the chat as well.
Okay.
There's another question from Tamara Laytart. She said, if we received a separate grant for our local emergency shelter, do we need to complete these forms for that grant as well?
If you have an emergency shelter that we have 0 ESG-CV dollars in, then you would not. So you're only going to fill this out for the specific grants that you did receive from us. So if it wasn't funded, we aren't doing this process for our regular grants. We're doing it for the COVID money and getting that handled. And then at that point, we can do the final report and people can stop submitting all of their reports every, quarter.
There's a question from Lisa Warden. She said, we did require ESG-CV recipients to include duplication of benefits in the participation files. Can you explain the subrogation agreement requirement for ESG-CV?
So the subrogation agreement was made by Tim Allen. And it's intended to be, I almost combined it with the other form, but ultimately I ended up leaving these alone. So let's go through the subrogation agreement. So like I recommend that you do your worksheet first, right? Because it's going to calculate all that for you. So you go and put your applicant name in the Excel sheet. You have the activity by component that you can look at that will tell you all what those are, but essentially it's your budget areas. I'm not down to granular line item level. It's at that activity level. And you'll talk about what other resources that they have, right? So what you say is your total need is there. What you're asking for, how much of it's not duplicated, how much it should always say 0 duplicated. And then you have to sign off. This was a form created by our compliance department. So I wasn't part of creating this. What I do know is that we need it signed for any kind of grant that had CV funding in it as an office.
Great. And then there's a question from Jamie Rice. She says, I run a homeless shelter and our ESG-CV funds have been used to purchase bedding, toiletries, pillows, towels, and furniture. Almost all of it has been expended so far. We have not used funds for rental assistance or anything of that nature. Sorry, I'm just lost here about how we could have duplicated anything.
I don't think anybody has. I don't think anybody, it's really hard to spend you'd have had to somehow, bought the same toilet paper twice. I don't think anybody necessarily has duplicated the benefit. What we're saying is that HUD is going to come, and I've talked to them about this situation. I talked to the consultant about the situation, and we just need to do the form to show it, because at the time of application, all the other resources that folks get weren't included in what was submitted as the application. And what HUD was saying is we have to assess and include those, and that didn't happen. So we are having to go back and do that. So I don't think anybody's duplicated a benefit. Everybody would have asked for what they thought they needed, but we don't have any way of proving that that's been assessed or communicated, because we set this up to get the money out the door and in everybody's hands as quickly as possible. So that was the intention around it, was we were in a pandemic and just getting this money out as fast as possible. So no, that it doesn't mean that we think there was one. What it means is I have to do some paperwork to show HUD that we didn't, because that was not assessed on the front end.
Okay, and then there's a question from Allison Gill. She's asking what time frame should be used with respect to need for ESG and ESG-CV awards.
Can you repeat that, Brooke?
Yep. She said, what time frame should we be using with respect to need for ESG and ESG-CV awards?
Okay, so this whole process is about your ESG-CV grant. So your time period is going to depend on when you did it, right? So we're taking a screenshot and going back in time and saying, this is where we thought this was and what we needed, and here's what else is there. And then you would be projecting through 9/30/23. In the Excel sheet, it says 10/31. That's allowing for your draw, but all that work has to have been expensed at 9/30/23. So that is the time. It'd be starting when you applied and ending at 9/30/23. Although I recognize that at that time we thought this money was going to be gone by now too, but they did extend it. But that's the situation, you know, that we're in right now. So if we're looking at amendments on, we're just going to shoot for that 9/30/23 date, and that's kind of why the duplication of benefit. I didn't want to run two trainings and like these are two things that are different. However, they connect to each other, and we wanted to get these through as easily as possible and just get it handled. But just think at the time of your application, what was your realm of possibility?
There's a question from Barbara Holman. She asked, did you state that we need to go back and review old participant files if we didn't have a formal form in the file? If so, how far do we need to go back?
I did not state that. I would like everybody to look at their client file, see if they're assessing whether or not they did that. And then if you did none of those things, reach out and let's just talk through them and look at those forms, keep sure. I understand that clients may have disappeared or not in the area and those kind of things. So this training happened today. You did not know those things at the time. So now that we've shared that, we want that going forward. But if we're going to attempt to go back in any kind of way, I think that should be more of a conversation and keep sure, because it's really hard to find all of those clients. I'm not telling anybody not to do that. But I also think that we need to talk about these individually before we put that kind of effort out. Because I know I went through that with HPRP, right? We went so far in, and then we were building a plane while in flight, and then all of a sudden there's this form, and we had to. I know what that's like. It's very difficult, and what will happen is we will come and monitor, and if we find that's not going to be like you have to pay this back, like I recognize that we didn't say anything until this training. So let's try to see if it's in our file first and then have a conversation from there about what's even realistic, and just double check and keep sure, the forms, or there's nothing in there that will work. But definitely moving forward, do that. I don't think it's even possible to go all the way back to the beginning of this. It might be for some clients, but for some, it's not going to be.
Right, and then a question from Marty again was, so this is only for ESG-CV going forward. If we do not have remaining ESG-CV, then does it not pertain?
It doesn't matter if you have money or not left. So you still need to do the forms. Now the recapture form, Marty, only you would, only those of you that already turned it in and talked and worked with your grant manager, maybe the recapture form, but that's not enough people. And so everybody else, just close your ears on that one. Everybody has to do the forms regardless if they have money left or not. With the duplication of benefit, it still needs done.
I think we covered everything then.
Okay. Well, we still have 51 people hanging on here. I want to thank you for doing that, and thank you for your patience as I learn my way around this new platform. I recognize that it was not fun, receiving this information, and we'll get these forms done and try to make it, easier on the reporting in after this. Everybody has been working really, really hard through the pandemic. There's so much going on, and I applaud everybody's resilience through this. Housing stock is limited. I'd hope to, have more time to talk through that today, but we'll go ahead and put that in the policy meetings. But I want this process to be as easy as possible for you guys. This isn't a got you type of thing. I want us to be partners through this and work through it together. And you have my deepest apologies that you're hearing this information now, especially those of you that thought you were done with ESG-CV. I came from the homeless program arena. I've worked at a local agency, everywhere from the emergency shelter to housing stability, permanent housing. The only homeless program I've never really done was Hopwa. So I recognize how this feels to hear, and we'll work to do better in the future, keeping sure that we're providing and collecting the things that we need to collect. I think this was well intentioned. We had the pandemic. We wanted everybody to have the resources as quick as possible. HUD issued that guidance, and we're doing the best we can, in the situation we were in. And, if you guys need additional CV money, go ahead and send that in now, work with your grant manager, and, let's get this money spent by September 30th. You guys are doing a great job, and I appreciate all the work that you guys are doing. All right. With that, are there any questions or comments before we end and I stop standing in the way of lunch? All right. Well, thanks everybody for hanging in for my first time with this. You guys have a lovely rest of the day.